Hi everyone, my name is Megan Weezer. I am the newest physio coach here at Recharge. I'm a physical therapist and I also coach classes here. What we're going to go over today is a couple of things for knee health. A lot of times when we get pain anywhere really, not just the knees, people tend to kind of rest and decrease their activity level, but it's really important to either increase or maintain a certain level of activity so that your muscles can continue to work and support the joint. So we're going to go over a couple of exercises for that for you. Okay, so the first exercise we're going to go over today are Spanish squats. It's really important for knee joint health and for maintaining quad tension. So Mandy here is going to place her feet in the band. The band's going to be behind her knees. And you're going to step back a little bit so that the band wants to pull you forward. And you're gonna sit back in your hips, trying to keep your shins vertical the whole time. It's really good for maintaining and developing quad strength. So oftentimes with knee pain, people don't either have enough quad development to begin with, or their quad strength is decreasing. So this is really important for knee health overall. So this is a good go-to exercise with any kind of generalized knee pain. Next up, we have some loaded alternating marches for you. So a couple key things you want to keep in mind. So you're going to hold either a kettlebell or a dumbbell, some kind of load or weight in a goblet position here. Keep your core nice and tight so don't hang out too overarched here. So rib cage down, core nice and tight, and you're going to slowly shift your weight onto one leg and march with the opposite leg. Go back and forth. So this is creating some tension not only in your quads, but in your hip extensors as well, on the stance leg, on the leg that's working there. With this, you also want to drive the opposite heel down into the ground to engage your gluteals. Next, we have a unilateral farmer's carry or suitcase carry, whichever name sounds more familiar to you. So with this, it may seem like it's working your arms, which it is, but it also helps to create some tension and load your lower body joints too. Specifically, when you have a weight in one side, it's mostly loading the opposite hip. And if you try this on both sides, you may notice that it's harder on one side versus the other, which could be either you're having trouble developing hip tension in one hip, or it could be an upper body issue. But this is a great way to load the hips and lower body without going through any painful or achy ranges of motion. All right, so last but not least, we have a loaded squat to a raised surface for you. So sometimes you'll notice when you have knee pain or even hip pain, it's hard to get into deeper positions that require extra control of your range of motion, of available range of motion in your hip or your knee. So what you can do is raise the surface and bring it to you. So here we're gonna do a loaded goblet squat. To a raised surface, to a bench here we have. So if you have an ottoman or a couch at home, you can put some pillows or cushions to raise the surface to you. So you want to make sure you're sending your butt back first and then letting the knees break. And to maintain that hip tension, you want to pretend like you're pushing your knees out to the side. So just to review, we have the 4 exercises that we went over today. We have Spanish squats, loaded alternating marches, farmer's carry or suitcase carry, and goblet squats to a raised surface. I would try these for about a week or so first and see how you feel. If it doesn't get better or if things aren't changing, get in and see a physical therapist.